So he coughed up a stick. So we're trying to get x-rays right now. He's not pulse oxing great. Thank you, Parker. So he's definitely gonna have to go on the vent.
Okay.
Yeah. Not that the colors.
Yeah, it doesn't look.
Dr. Kaplan was very helpful in talking me through everything with the ventilator. It felt like she was right there with me.
BP's been fine. It's been anywhere from 100 to 110.
Oh, good.
Yeah, his BG was 143. I mean, he's super dehydrated, but he doesn't seem like he's hypovolemic. And all of his other vitals are normal. Like he's normal thermic, heart rate's normal. Well, it's elevated, but it was around 180 when he was sedated. And then he was very dyspneic. But after that, his blood, yeah, everything else stayed fine the entire drive.
Okay. So as long as you've got enough propofol there, we can get him started on the ventilator with just a propofol CRI, and you can add any others as we go along.
Okay.
If people wanted to try to place an art line, it'll help you get the blood pressure, because once they're on the ventilator for a while, they get really edematous, and so the Doppler can be a bit hard to start reading. So those arterial lines are a bit easier to have in and keep them on the vent.
Okay. Okay.
If you want me to help you with the doses of the drugs, if you just tell me what you're going to put them in, like if it's going to go into a syringe or if it's going to go into a bag, I can help you with that.
Syringe.
Syringe? Okay. Yeah. So for the propofol, I'd probably start at like the 0.5 or 0.6 mg per kg per minute.
Okay.
So is the pup on a propofol CRI right now and under a good plane with it?
They are. Is the pump on right now for the CRI propofol? They're working on it right now. They're doing it.
Okay. So before hooking her up, just make sure that we get her on the propofol CRI first, and that's doing a good job keeping her under so she doesn't buck the ventilator when we switch her.
So we were able to use the telehealth through VetNOW with Dr. Kaplan from Nebraska. And the dog was pretty critical. We had a lot to do IV catheter-wise, medication-wise, just to get the dog under some general anesthesia to calm it down because it was hyperventilating. We were able to have Dr. Kaplan give us those medications directly. She was on a TV with a camera, and she was able to see us. We were able to see her. We were able to hear her, and she was able to see the dog and the ventilator as well. I think it worked out very, very well having somebody that close with us and talking to us. She was able to work us through the entire procedure and the patient care while not even being here, and it all went very, very smoothly.
So let's try her on LRS at only 10 mils an hour.
Okay. Blood pressure.
And then if her blood pressure tanks after that, then we'll get her a norepinephrine CRI.
Is that your first line you want to go to? Because we have dobutamine.
Yeah.
We have all of that. Okay, so norepinephrine.
If you have the norepinephrine, let's use that. If you don't, use dopamine.
Nope, we have it.
Okay. And is the pup, I don't see the puppy. Is she sternal or is she on her side? If she's on her side, let's get her sternal.
Where we tried stabilizing her with a criticalist from Nebraska over VetNOW. And it was a really enriching experience where she kind of directed us as a team, our whole veterinary technician team, kind of stabilizing this patient.
Or what do we have the ventilator set to give?
The ventilator set at 20 for her respirate, but her respirate right now is 117.
Still hyperventilating.
Okay. If you can adjust how many breaths per minute we're giving her, let's bump her up to 30.
And do we have any x-rays of him recently or no?
Yes, we have x-rays from today.
Okay, can I see them? Are they loaded up or are
Let me pull it on. It's on a stairs, but I can pull it up on this iPad right here.
It'll be easier for me to look on a stair.